Okay, so a lot has happened since the last time you and I have sat down and spoke. Clearly, the world is changing by the minute, not even the day. What can you tell us about the latest with not only what's happening with you, but also just the medical infrastructure?
So let me just very quickly summarize since the last time we spoke what's happened. So worldwide, we could still see that there are some countries that are starting the serious lockdown with increasing number of people being infected. You know, unfortunately, our colleagues in Italy, those in healthcare, physicians, nurses, etc., clearly are seeing a huge burden. As a matter of fact, last week, a very good colleague of mine wrote a small article in New York Times saying that his country's healthcare is collapsing. And it is very sad because there are, again, limited resources. On this side of the ocean in the United States, as anticipated, we're still seeing an increase in numbers of people being infected or being positively tested. And we're also seeing now people coming into intensive care units with significant respiratory failure. The virus, as we learn more and more about this virus, it, by the way, is not new. There have been some articles published in 2007 in China identifying the coronavirus. But the fact of the matter is that travel and transmission was not as the same. Maybe the virus also had mutated, become more virulent over time. So we're seeing, since we spoke, we're seeing clearly an increase on the burden of healthcare. There has been shortage on PPE, personal protective equipment. The shortage is, we're hoping, is temporary, and hopefully by this week, with everyone pulling together, both conserving what they have as well as increasing manufacturing, we'll see that there's sufficient PPE for that. The problem with PPE, as you know, when you gown from head to toe, it takes time to get into it. And clearly the risk always is in the removal of it, because that's when you can infect other people. As we see this rolling through the country, meaning the different fashions of lockdown, many of the cities and including some of the rural areas have become really ghost towns because everyone is complying.
That's a good thing, right?
Absolutely. What I was going to say, whether other fear or with the rational understanding that they can expose themselves to unnecessary infection is there. Clearly, hand washing and not touching your face, all of these activities still remain, because as you go out to get food, you have no idea who's been there before you, so that we need to practice that. The U.S. Government, or the Department of Health and Human Services, clearly is trying to get models to predict where we are in the United States. Many of us in the healthcare profession believe that we're looking at possibly 2 to maybe 4 weeks, maybe on the outset 6 weeks, where we're going to start seeing the decline in the number of patients being infected. Although most viruses respond to the change in temperature, high temperature and high humidity, they don't do well. There is some information about this particular virus that does not respond in the same fashion. But the reason they're saying that is because Australia, which is the summer there, and Southeast Asia clearly have infections, and they're in the summer period. I'm not sure that that's a good conclusion, but we'll have to see. So there's still...
Wait, real quick, why wouldn't that be a good conclusion? Just if you can expand on that.
Again, the temperature itself may by itself not be sufficient. You need the humidity. We know that Australia has been very dry, even though it's been summer. So, you know, there's a lot of play in terms of understanding why there's infection there versus, you know, summer, they shouldn't have any infection. So I think that that's why it's something that we can't really conclude. Again, here in the United States, our testing is still coughing, as you know. It's not something that we can be proud of at this point. The amount of time required for a test to return still is significant in terms of number of days. So those people who are symptomatic and get tested, the 14-day still applies. And when people ask, how long does it last in your body? Well, we know that there is a time between the time that you're exposed to actually being ill, and that's 4 to 6 days, with probably a tapering off to 14 days. Now, it's the 14 days is a nice margin to give people, so the virus may not last in your body as long as that, but we have to be very careful that we don't send anyone into the outdoors or the environment being infected. Those who have perished and passed away, it's unclear what the virus is in there, and I think we're going to learn more from China and from Italy as that develops. But that's really not a concern for somebody who's been infected and is feeling better.
Okay.
So that's basically where we are today. We're working very hard to equip everyone with PPE in hospitals, triage areas that separate the COVID patients from non-COVID patients. The big concern, of course, is that COVID patients in the hospital may, again, infect non-COVID patients, which
Right.
come in for one thing, you shouldn't have both. So a lot is being done to those.
Okay. Well, we got a bunch of people who responded in a really great fashion and wanted to know more and are trying to sift through pieces of information versus opinion out there, especially from people that don't have medical degrees. So they put together a bunch of different questions, sent to my DM, and wanted to share some of them with you and get some responses, because these are people that may have access to a doctor, may not, as you know, the healthcare situation in the country. So this is kind of a way in which they may be able to get some information without it being sent with some sort of opinion or some sort of slant behind it. All right.
Okay, sure.
So Michael starts, says, I took the COVID test, but I'm still waiting my results. They ruled out the traditional flu this morning through the test. At this point, I either have COVID or a cold. Do you happen to hear or know that it would be positive on test within a certain amount of time? Like how long it stays in your body for it to show up? And that's similar to what Massimo asked, which is how long can someone be contagious?
So clearly you're contagious. You can be contagious with what's called a carrier, meaning that you have virus on you. You're asymptomatic, and you are clearly coughing, and they're aerosolized droplets that you produce where they can infect other people. So those patients clearly are stealth. We have no idea who they are, right? On the other hand, if you're symptomatic, so it takes, as I mentioned, between 1 to as long as possibly, meaning 4 to 6 days after exposure to become ill. That is when the infectious transmission is the highest, is when you have the highest amount of virus particles in you. And then, of course, it sort of dies down over a period of time. The 14 days is a very good margin of time where we consider patients who are being quarantined with symptoms, or even without symptoms, as you know, to protect the environment, meaning other people, from infectivity. So I can't give you exact dates, but I think that the 2-week period is one where we feel strongly is one where it protects you from other people, and vice versa.
George asks, what can I eat outside of the food I've already purchased in my home?
Well, I don't think that there's any, again, unless George has any underlying nutritional issues or medical issues, for example, diabetes, where clearly high sugar intake is not recommended. I don't know that there is a specific recommendations for any specific diet to either prevent or to reduce the effect of the virus. There are some clearly Chinese medical recommendations. Of course, no cold water when you have a fever. Those things are clearly embedded within the Chinese medical culture. So there may be some of those recommendations. as long as they feel comfortable using those, I can't make a recommendation one way or the other. But specifically, there's no diet that we would recommend.
Okay, and I guess as far as maybe to take it a step further here with George's question, there shouldn't be, as long as you're practicing the same sanitary practices you would going and coming back to your house, there shouldn't be much concern at all about takeout or delivery for that matter.
So we are clearly in a period where we are discouraging people to gather.
Right.
So at the same time, we also are sensitive to the economic burden of what we're doing. So yes, I think that if you're looking at it from a point of view of weighing one versus the other, food delivery, which is clearly not a direct exposure, and also the wrappings can be handled with gloves or any way you want. You can wash your hands after the delivery, clean your door handles. All of the sanitary recommendations should be used when you have food delivery, whether it's from a restaurant or whether it's from a grocery store or a supermarket. But we feel strongly that this form of food delivery clearly complies with the social isolation that's being recommended.
Okay, Jenna asks, why would we stop social distancing and go back to normal in a couple of weeks rather than a couple of months? I know that's been floated out there recently, the last day or so.
So there are a couple of ways of looking at this issue. From a purely medical and public health point of view, social distancing that we're recommending is one where it clearly reduces the amount of individuals and the frequency of infection and transmission. The social distancing that has occurred here over the years, over the months or weeks, I would say, has had some significant economic impacts, as everyone clearly realizes that. And when you're looking at the activity of social distancing and you look at mortality, we're talking about, again, these are hard, non-emotional calculations that each life saved is costing us in the billions of dollars. So that is why it's being raised. I don't have an answer for the economists. I only have the answer for the public health people, which is, right, as long as we feel that we need to contain activities of human beings who are potentially transmitters of this particular virus, that we do that to the end. We shouldn't really stop and reassess with only one aspect, meaning the economy being the driver. If we're going to reassess, it's because something is not working, not because it's costing.
Got it. All right, finally, Mike, what's the deal with the fish tank cleaner and people trying to self-medicate?
I think that all these things are not tested.
Right.
If I say don't do it and it turns out that someone has done a very good study and it tests positive, meaning that it does protect you, we just don't have. I see every day multiple recommendations of things to do. And even in the medical profession, I could tell you that there have been some recommendations made about drugs. And if you look at the actual data that supports the use of these medications, it's at best equivocal. Now, it doesn't mean things are not going to work. We just need to get this stuff organized in such a way that we have actually an idea that it works and when to use it and how long to use it. So it's not just that, oh, we have a drug, the anti-malaria drug. If that works, what is the best effect in terms of timing to administer it and for how long? We don't have these answers.
All right, so let's end on somewhat, if we can, of a positive note. We've got about a minute, 90 seconds. It's all yours. What's the most positive thing you can look at that gives you not even hope, but tangible, something you can reach out and say, that's going to be part of the reason why we come out of this? Even if it takes 4 or 6 weeks, that's fine, but just something over the last week that has given you tangible, something positive that you can grip and say, this is going to work or at least help work.
Well, the most important positive signal that I have, right, is actually looking at you. However, I understand what you're asking, and I think the positivity is the enormous participation of every American to try to beat this thing. And the sacrifices that people have made, we have not seen that in centuries, maybe not just decades.
Right.
I think that that in itself is huge, huge in terms of beating this virus. And as we continue to again sacrifice and pull together, I think we'll be a different country than we are before starting it. So there's always look back. There's always something we can learn from these disasters. I heard today also that the locusts are eating all the food in Africa at this point. There's a big, huge, so again, you know, we're hit with one thing, some people are hit with multiple things. So we need to stay on the positive side. We need to keep sort of a balanced approach to this, because social isolation and distancing is not easy. And the economic burden, as we're watching that happen, we hope is going to change soon, because we are also expect Wall Street to be responsible the way the rest of our citizens are. So all in all, I think that it is a disaster. We have our war paints on, but at the same time, we're working together.